Hi, my name is Siobhan Cullen and I'm a physiotherapist working here in the South Infirmary Victoria University Hospital in Cork, and we've just made this short video to tell you a little bit more about what to expect from a physiotherapy point of view following your total hip replacement. From our point of view, if you could bring in with you a good pair of supportive shoes, nothing backless and no flip-flops. And if you have a walking aid or a pair of crutches at home, you could bring them in too, and if not, we'll supply them. You should also bring in a copy of your home exercise programme, which you should have received in the post. The usual length of stay for a total hip replacement is about 3 days, and after the surgery it takes a little while for your anaesthetic to wear off so that you can feel and move your legs again, so physio has to wait for that to wear off to begin. If your surgery is done very early in the morning, there's a chance your power and sensation may have returned sufficiently to allow you to have physio that evening, and if not, it'll be the following day. When you do first see physio, we'll go through your exercises in the bed, and as I mentioned, you should have received these in the post, and it's a good idea to familiarise yourself with these before your surgery. There is a QR code on your exercise sheet that when scanned with your mobile phone will bring you to our YouTube channel and a list of videos which show you your exercises for after the surgery. You might find this useful to look at. When we do see you, we'll also briefly review with you your hip precautions or movements to be avoided after the surgery, and that's namely bending past 90 degrees, bringing your operated leg across your midline, or twisting on your operated leg. But these will be gone through with you in much more detail by one of our occupational therapy colleagues on the wards. When physio do come to see you, there will always be two of us, and we'll go through your exercises on the bed. We'll help you out of the bed and start you walking with a Zimmer frame, and this is our standard procedure. If and when appropriate, we'll progress you to elbow crutches. You'll walk around the room, and you might sit out for about half an hour. For the first day, or until your physio advises you otherwise, you should ask for help to mobilise and shouldn't do so by yourself. Every day after your first day, we'll see you to run through your exercises and give you some additional ones to do in standing. And before you're discharged, we'll make sure that you can get in and out of the bed independently, mobilise safely on your aid, and that you're familiar with your home exercises and hip precautions. We'll also do stairs with you if necessary before you leave. When you do go home, you'll find a balance between a little rest, a little exercise, and a little walking, and your physio will advise you on to how to find this balance before you leave the hospital. When you do go home, keep up your exercises, and most often you'll not require any outpatient physio follow-up. Your consultant will see you a number of weeks after the surgery, and at this point, if they feel you would benefit from further input, they'll refer you to us. Otherwise, that's about it from a physio point of view. If you do have any questions, please do not hesitate to contact us on 021 492 6656. Otherwise, we'll see you soon on the wards.